This podcast covers the muscles of the knee joint. The knee joint is a modified hinge joint, which means that we can flex, extend, and rotate the knee. So there are muscles which do all of these movements. So we're going to start by talking about the muscles that actually extend the knee. The muscles that extend the knee are the quadriceps. Quadriceps means 4 heads, and there are 4 main muscles, 3 of them called vasti and 1 called rectus femoris. So imagine that you have 3 vast pints of lager and you get absolutely wrecked. And that's one way to remember it. Vastus medialis is the muscle on the inside of the knee. It's sometimes called vastus medialis obliquus because its fibers pull at a really strange angle, almost horizontally, to counteract the pull of the other 3 quads and stop the patella from dislocating laterally. Vastus medialis comes from the medial femoral shaft, and they're so big that they actually come from around the back of the femoral shaft on a roughened line called a linea aspera. All of the quads end up in the same place, so I'm going to just give you one insertion point for all of the quadriceps, which is the tibial tuberosity. The way that they get there is slightly different, so they all insert into various parts of the patella. In the case of vastus medialis, it inserts to the medial border of the patella, and when it contracts, it will extend the knee. Vastus lateralis means big and on the outside, and as the name suggests, it's the lateral one of the quadriceps muscles. Again, that comes from the lateral shaft of the femur, and the linea aspera goes downwards and attaches to the lateral pole of the patella. Rectus femoris is the one on top and in between the 2 muscles, and it's the odd one out because it goes over the hip joint at the front, so it will flex the hip, and it goes over the knee joint at the front, so it will extend the knee, so it's a 2-joint muscle. Rectus femoris has 2 heads. It's got a straight head and a reflected head, which come from the AIIS and just above the acetabulum. It goes down the front of the thigh and inserts into the top of the patella and extends the knee. If you take off rectus femoris, underneath you've got another quad called vastus intermedialis or intermedius, and that comes from the middle anterior part of the upper shaft of the femur. Recently there was another muscle discovered which is called tensor vastus intermedius. Have a look and see if you can find out any information about that. If we take the quadriceps off, there is another tiny muscle called articularis genus, which is a very small muscle which goes from the anterior shaft of the femur and it attaches to the synovium of the knee. And what we think its function is to actually retract or move the synovial membrane of the knee when we extend it. The synovium of the knee is very big with lots of folds and reflections, and they can get trapped, so it's thought that articularis genus actually pulls the synovium out of the way. The muscles that flex the knee are the hamstrings, gastrocnemius and popliteus. So we'll start with the hamstrings first of all. You have 3 hamstrings. They all come from the ischial tuberosity. They pass down the back of the leg. One of them goes its own way down the lateral side of the leg and ends up at the head of the fibula. That's biceps femoris. Biceps means 2 heads, so biceps femoris has a long head and a short head. Because biceps goes behind the hip joint, it will extend the hip. Because it goes behind the knee, it will flex the knee. And because it goes laterally, when it contracts, it will pull the knee into lateral rotation. The other two hamstrings are kind of on top of each other. One of them is fat at the top and thin at the bottom, and one of them is the other way around, and they're called semimembranosus and semitendinosus. Again, they come from the ischial tuberosity. They pass down the medial aspect of the femoral shaft, cross over the back of the knee, and go to the medial part of the knee. So when they contract, they will again extend the hip, they will again flex the knee, and because they go to the medial aspect of the knee, they will internally rotate the knee. There is a part of the knee on the medial side of the shaft of the tibia called the pes anserine or pes anserinus, which means goose's foot in Latin, which is a bit strange, but it actually does look like a goose's foot because you have three tendons that join at the same place and stick out like the toes on a duck or a goose's foot. And the way to remember those is say grace before T, S-G-T. You have sartorius, gracilis, and semitendinosus. So have a quick look at the pes anserine. Another muscle which flexes the knee is gastrocnemius. Don't forget, a muscle will only do what it can over the joint that it goes over. So because gastrocnemius goes over the back of the knee, it will flex the knee. It's got two heads. It's got a medial and a lateral head, and they come from just above the femoral condyles in the supracondylar area of the femur. And gastrocnemius is a two-joint muscle. It goes over the back of the knee, so it will flex the knee, and it ends up in the Achilles tendon, which goes behind the ankle, so that will plan to flex the ankle. There's another muscle in the calf called soleus, which doesn't go over the knee, so therefore soleus cannot do anything whatsoever to the knee joint. One of the more complex muscles in the knee is a muscle called popliteus. The word popliteal means the back of the knee, so the popliteal fossa is the space at the back of the knee, and there's a popliteal artery and a popliteal vein as well. Popliteus is a muscle which actually flexes the knee and causes rotation of the knee as well, and its attachments are quite complex. It comes from the lateral condyle of the femur and part of the meniscus, which is interesting because what we think it actually does when it contracts is pulls part of the meniscus out of the way and stops it from being squished or nipped. It goes diagonally across the back of the tibia. It blends with the capsule of the knee, pierces the capsule to some extent, and ends up attaching via a sesamoid to part of the tibia. And what it does is it flexes the knee because it's at the back, and it also rotates the tibia medially on the femur, which is the same as saying that it rotates the femur laterally on the tibia. It all depends whether the foot is fixed on the ground or not. And it's thought to be important in resisting rotation in the knee and also unlocking the knee from a position of full extension. It's worth mentioning that there are other muscles which have an effect on the knee. So interestingly, gluteus maximus, through its insertion into the iliotibial tract, can exert some stabilizing effect on the knee. Probably the same thing applies to tensor fascia lata, and sartorius and gracilis both cross the knee, and again they may play a role in giving some stability to the knee joint.